Okay, this is going to be composite number 2 for skills. The difference between 1 and 2 is composite 2 is going to use the matrix band holder. So now we're doing a 2 surface or more filling on the posterior teeth, and we're just going to use composite. So same steps, mirror and explore, just like we've shown you before. We're still going to go through anesthetic, so you'll need the cotton tip applicator and then the aspirating syringes, and again, you know that there's different colors depending on where you're working. Once they're numb, we'll use the high-speed handpiece and the slow-speed handpiece, and you will use the HVE, and then we're going to use the spoon excavator. The spoon excavator you've seen a few times now. It's going to remove any excess decay. Now at this point, this is when we're going to put on the matrix band. So if you've not seen the video yet, please be sure to watch the video on how to set this up. You pass that to the dentist and they will put that around the tooth. It's kind of like it's hugging it. It's a way to make the walls of the tooth. So once that's done, we're going to go ahead and use that acid etch, and the dentist will place it in the tooth, and you're going to let it stay in there for 10 to 20 seconds depending on the manufacturer, and then you will rinse it. The assistant will use the air water tip and the HVE, and be very careful rinsing that. We do not want that acid etch anywhere else in their mouth. Now we need to use the bonding material. That would be 1 drop of bonding in that little disposable well, and you use the microbrush. Once you do that, you're going to need to set it up with the curing light. So the assistant would put that right on the tooth. Now a lot of times when you're doing a bigger composite filling in the posterior, we will layer the composite material. That means we're going to use a flowable composite first, that's liquidy. That'll be what we put down as a base in it. We'll use that flowable, and then we have to use the curing light to set that up. So that's the first step, and then we're going to go ahead and use the regular composite, the ones that kind of like a putty. So you pass the composite gun, and again, remember that there's different shades of composite. You would figure that one out ahead of time. And then you're going to pass the plastic instrument. Once that's all packed in, you're still going to use the curing light to set that up. And then it's as hard as it's ever going to get. So now we need to remove the band. So I will remove the matrix band, and then you're going to pinky grab the matrix band holder and give me the cotton pliers so I can very carefully remove that band. And then we'll use the high-speed handpiece. That's to put some anatomy back into the tooth and make it look nice. And then we will check the bite to make sure that it's not too high. We will use the articulating paper holder for that. If it's high, we'll go back to the high-speed handpiece. And then the very last step is going to be the sandpaper discs. That's to smooth and polish the filling. And then a final rinse, and that is composite 2.